Oh, so good. Happy Sunday. I forgot about that. Happy Sunday. I'm on for just a little bit, maybe 15 minutes to 30 minutes to answer any questions. This is like an impromptu live too. Regarding utilization review, I have the next class scheduled because for May the 2nd. It's supposed to be like two weeks apart, but um, we have a family reunion, so I'm not able to do it 2 weeks exactly apart. But again, I'm here for any questions regarding utilization review. Again, so let me just go over my class. It is live. It's a live class. Let me make sure my volume is up. It's a live class and it's scheduled for 2 hours. We usually run over because I want to make sure that you have a clear understanding. When you sign up for my class, you will receive like interview questions, a telephone script. But you will learn in the class how to document what a denial looks like, how to write up a denial for the physician reviewer, and again, how to communicate that. We won't be going over MCG, although I am familiar with MCG, which is if you're a nurse, you're pretty, or if you're medical, you pretty much know what MCG is. But I'm not going to go in depth over that. I'm teaching over interqual. That's more my expertise. I've been a UR nurse for over 12 years, pain management for over 10, either 9 or 10 years. So um, I thought, why not do the class? Now, my class is, as you see, it's $89.99 instead of being $800 or $1,000. And the reason for that is because, especially in this economy, I think that's, and not knocking anyone else's hustle, but I think that's just unattainable sometimes. So, but if you feel like you're going to get a less quality of information, that would definitely not be true. And again, I'm always there to answer questions. So yeah, let me post on Threads and I'm live because I forgot to do that. But okay, and then when you just also too, when you do sign up for the class, it does route you, because I'm a patient advocate too. And that's another thing. You can get into um another lane using your nursing skills. So I decided to become a patient advocate because I know so much about appeals and denials. So I do help people with that too. But um, anyway, so let me just go back. Once you sign up for the class and you pay for the class, it does route you to my Wix page, and you'll see you get a receipt that says health equity and it doesn't even say all liaison, but it is a true class. If you have any questions for it, you can put your email in on the website. You put your email and I send you the UR assessment. And that assessment, you don't have to fill it out. It's just for you to answer questions to see if you're ready to be a UR nurse. But I'm here for any questions or anything. And I have like, God, I have so many. Um, I feel like sometimes my life is getting taken over by social media. And I believe I am the only person that is teaching a live UR class. They do have download, like you can download the class, which is probably better for some people, but I just think you get more bang for your buck because you have my attention at that time. And so ask me. You'll get my phone number, you'll have my email address for you to follow up if you have any questions regarding, UR, or if you're nervous about doing the interview, we can always schedule a call to do a mock interview. So those are some of the things that I am offering. So sorry about this, you guys. I am trying to. My brain be everywhere sometimes. So this class is perfect for if you're just trying to get out of bedside nursing and you don't want and you're becoming burned out by it. This is a perfect class for that. To just segue yourself to where you're not you don't lose your nursing, license or anything like that. You're still practicing nursing. It's just a different part of nursing. Now, the majority of the companies I work for are remote. Some of them are hybrid, and because I'm so far away from my company, I'm 100% remote. So I live in Florida, and I'm 100% remote. As everyone knows, Florida does not have the best pay for nurses. So even me working for a company here, you're gonna have to pay me a lot more than what they're making here. And I have a decent salary for sure. I used to work for OrthoNet. I don't know if they exist anymore. I don't know, but I made a damn decent. I was making 80 when I left. I was making $83,000, and I know the RN started out at 100,000. So again, once you become a UR nurse, I'm also going to think about getting a license. I have a license for um, the North, Massachusetts, and for Texas, and I'm also going to get one for Cali because I feel like they make really good money. So that's the flexibility of being a UR nurse. I'm not leaving the state. I'm just going to, and they have you work remote. And that way I'm getting more money and my money goes further, especially in this economy that's always needed. Again, I don't go into work. So, and to be honest, I just came back from getting an oil change on my car, and I haven't even hit 3,000 miles in the last, it was 11 months, 10 months on my vehicle. Um, so yeah, I feel like it's worth it. I'm still using, and again, my specialty is MSK. So I do ortho, joint spines and things of that nature. That's what I do. I'm not teaching that class yet. I'm just teaching the basics. So what you're going to learn is how to triage your cases. It's a time limit on cases to have. You have to get them done in a certain time. You're going to learn about what to look for, how to document, um, how to review using interqual. Again, telephone etiquette, you know, HIPAA compliance with calling on the telephone. These are things that you're going to learn in my class. And again, it's 2 hours. So I'm just asking for 2 hours of your time from 9 to 11. And again, it runs over, but not everybody runs over. We're all at different levels of learning and understanding. So, like I said, I'm always going to say it's worth it. And 89.99, and people are so shocked. Like, you don't know because it's hard out here. And I don't feel like I need to be be at this time. And like I say at this time, I feel like 89.99 is doable because you're investing in yourself. And again, I'm not knocking anybody else's hustle. They make a lot more money than I do, and that's awesome. That's great. But I thought 89.99 was a good price for what you're going to get a really good understanding on what being a UR nurse is. I can even tell you my day. So my day, I get up about 7 o'clock or so, 7:15. Get my son ready. I have to be logged on by 8:30. Um, Sometimes I go for a walk in the morning time if it's not raining or it's not hot in the morning like that. But if it's not raining, damn, it's got me dark. What the heck? I just have light. Like, child, let me put some light on me. This thing is a hater. It's like the sun. Hold on. I don't, Better leave it here. I have to put the light on me. But anyway, so yeah, I go for a walk in the morning time. Now, what I'm doing, I'm going for the walk in the morning time because I'm sitting there. I go for a walk in the morning time, and I go for a walk about 11, and then I come back and finish more cases before I go pick my son up. I only pick him up 3 times a week, so and I pick him about 12, 12:20. It's before 12:30. And I'll go pick him up, and that is considered my lunch. And I have time to go get me something to eat, come back, finish up my work for the get him settled, finish up my work for the day, and then by 4:30, majority of the time by 4:30, I'm off. It might be, of course, some it's never 100%, because anything can happen. But my company definitely does not want you to work past 4:30. Like they are very much like, if you can't don't even open a case if you can't get it done by that time. But of course, we all do. I work for a really good team, so that's some of the commitment to it. But with being a UR nurse, like you can move around. Of course, the economy was a little bit better than what it is now, but they're still hiring for UR nurses. I post on my Facebook page, which is, I think it might be connected to this. I'm not sure, but I do post on my Facebook page and my threads the job posts that I do receive, and some of them are from recruiters. And another thing about it is because recruiters are reaching out, and if I'm not available, they'll ask, "Do you know anybody who is?" So you kind of have that contact, right? You kind of have that contact to go, "Oh no, I don't know." But if you're one of my students, I'm like, "Okay, well then I think this person." Um, might be a person to reach out to. Once you take the class, you're going to see that you have the experience, right? You have the experience. You have been a nurse and you have any bedside, clinical, urgent, all that, urgent care nurse, emergency room nurse, you have that inside. You have the knowledge already. You just have to apply it. It is rewiring your brain because when we were nurses out on the floor, our brains thought differently. But using interqual, you are actually just answering questions. It's like a I'm gonna call it a tree, but I don't know if that's the right word for it. And you're going to connect the dots. If they don't meet, but nothing is ever black and white, right? But if they don't meet, then you send to physician review. We don't Nurses do not deny anything because that means we're practicing medicine, and that's not true. We can't do that. So again, that is something that you have to remember. Again, we do not deny anything. People always say that all the time. We don't deny anything. We do not. Let me see. I'm always also too available for questions. Um okay, what happened? This damn thing is so dark. I don't know. I'm always available for questions too. I do have my email there and you can ask questions and I'll answer what I can get to. But again, I would love to have you join May the 2nd from 9 to 11 a.m. Let me see. I don't think I'm doing anything Friday. So I think that I'm able to come back on. I don't know. I've been gone for a while. Um, I was going out of the country and I was supposed to come back on. I didn't do it. It was a total mess. Uh, we were all caught up in the whole flying back. The part flying back from Mexico wasn't bad. It was a part flying um when we got to the United States. That's the part where it got crazy. So we had to stay an extra day, but it's not a big deal when you stay an extra day because I'm able to work, right? So I didn't miss a day. I was able to work. It was just a part that we had to get back home. And we were able to do that. But that's the thing with being a UR nurse. It's not like me calling in because I brought my stuff with me to be able to work. So I didn't miss any days. So I'm not, and like, you have to take it up with your company, whoever hires you, if that's okay. And that's all I'll say about that. Now, most of the time, like once if my mom has to have surgery, and if she has surgery, I'm just, hey, let my company know, hey, my mom is having surgery, and I need to go be with her because it's on her eye, and so she won't be able to see out her eye, and I need to help her, and that's just me going like a couple of states up and helping her and coming back. You bring your stuff with you. I love being a UR nurse. It gives me that flexibility. But then too, I'm able to segue to other things too. Like I said, becoming a patient advocate or working for Cali. living in Florida. Now for California, you have to get your license, and it's over $400. I think it's like I know it's over three. It's $400. I hate to pay the money, but what I can pay, if I can make $30,000 more, I'm just going to set that $30,000 more and set it to the side and save all that up. That's what I'm going to do. So, like I said, that's a good thing about being a UR nurse. And then too, if you really wanted to, because I did know some nurses that um, if you want to do both, so you don't. With UR, it's flexible. You can do a part-time gig or PRN gig or a contracted gig, and that um, is great because if you wanted to, if you get your nursing license for California, you work for a company that lives works in you know what I'm saying. You can go there if you want to stay here, or you can go work on some of their. They make really good money. You can go work like and work there. I don't know how much the plane tickets are anymore, but that is a good thing about UR. Again, any questions for me, drop them below. I think I'm about to get off because, baby, I don't like to do all the damn talking. But I promise you, the class is worth it. It's a psychological thing, right? Because people think, just like anything else, this is cheap, right? Because you have, like, let's just say you have, was it Quaker oatmeal, and then you have the cheap brand oatmeal. The cheap brand oatmeal is just as good as Quaker oatmeal. It's just your preference. But I promise you that my class is thorough. I've been doing this for 12 years. I think it's about to be over 12 years. Yeah, so I've been doing it for 12 years. So my knowledge, and I did everything. DME, I did orthopedics. Um, Now, this is at the time when I first started, you were able to do physical therapy and speech therapy. And I did that too. Skilled nursing visits, I wasn't able to do that. I had to have an RN sign off on that for me because I am an LPN. I'm not an RN, I'm an LPN, which makes no difference because, again, my knowledge is, I have a really, really big knowledge of it. Non emergency transportation, I did that too. Let me think what else I did. I mean, out of network. So I think I'm done pretty much all of it. And so that's why my knowledge of UR is so vast. But yeah, I would love to have you come and take my class. And absolutely, I'm always welcome to feedback too, because that makes my class even better. But you're gonna walk away with the knowledge of being like, I am ready. I feel prepared for job hunting. And again, I do offer that mock interview. It does come at a price, but I'm not charging a lot for it at all. It's what is 30 minutes of my time? It's not a lot. And at that time, you have like a one on one, or we could do a one on one for an hour. It's going to be a little bit more. And that way, you can ask me all the questions in the world that you would like on that one on one. We can do the mock interview, go over any other questions that you have, how to prepare yourself. I'm gonna tell you what to ask too, because there are some certain things that you need to ask. Because for me, I do not like that whole answering the phone. You are like, I don't like that. That's not for me. I don't. Another thing, I rarely talk to providers. Most of the time, I talk to the staff, which can be frustrating. But I rarely talk to providers. The majority of the time, it is their staff member and educating them. But this class, again, it just gives you that head start. It's something you can put on your resume that you know interqual. And yes, you have some experience with it, because you're gonna have to write up. Yes, you're going to have to. I'm going to give you a case. You're going to have to write it up, and you have to send it to me. And I'm going to tell you what's good and what could be improved with your notes. I don't think you get that type of training anywhere else. Like, that's just me offering that because I know that works for you. But again, don't forget May the 2nd from 9 a.m. to 11 a.m. Eastern, because I'm in Florida, baby. I am not working late and it is getting hot. And so me and the little one, about it starts to heat up about 11, 12, but it's unbearable sometimes about 2, and I can't do it. But again, May the 2nd, 9 a.m. through 11 a.m. Eastern Time. Go on to my website. It is in my bio. Click sign up or click, and I can send you, once you do sign up, I will send you the UR assessment so that the way you can answer the question if this is for you or not. Again, enjoy your day. This is Nurse UR Review. You guys will be my utilizer. That's the name of my group is the Utilizers. And I can't wait and look forward to seeing you in my class. Enjoy your Sunday.